Good afternoon and welcome to another one of our live Q&A videos. My name is Leo and I'm the Senior Executive here at Sarcoidosis UK. I hope everybody is watching as well and staying safe. And I'm very excited today that we are going to be joined by Dr. Anne-Marie Russell. Now, Dr. Russell is a postdoctoral researcher with interests in interstitial lung disease and chronic pulmonary conditions. Now, she's very committed to patient-centered clinical research, which, as we know, is extremely important, especially with conditions like sarcoidosis. So let's welcome Dr. Russell to the screen. Hello, Dr. Russell, how are you doing?
Hi, good afternoon. Lovely to see everyone, and thank you very much for the invitation to join you.
No, thank you very much for being here. We're absolutely thrilled to have you here with us for one of our Q&As. Now, Dr. Russell and I met for the first time about 2 months ago, I think it was, at the Sarcoidosis UK London support group meeting where she very kindly joined us. And one of the things that she spoke about was a paper that she has co-written, and the paper was called Health-Related Quality of Life in Sarcoidosis, which is a very important topic, and it's what we're going to be focusing on today. And it's a paper that I recommend anyone affected by sarcoidosis reads, and you'll see why by the end of our conversation today. Now, as always, we have a list of questions that we have prepared in advance. But if you're watching along and you do have any questions that come up as a result of anything that we say, please do leave us a comment with your questions and we'll try to get through as many as we can in the time that we have. So I suppose the first important question is about the title of the work, which is Health-Related Quality of Life in Sarcoidosis. Could you define what's meant by health-related quality of life in sarcoidosis for us, please, Dr. Russell?
Okay, so let's start with a really easy question, shall we? I think health-related quality of life is very complex. You will hear terms such as quality of life and then with health prefixed in front of that. And so quality of life is something that the World Health Organization defined more than 30 years ago as physical and mental well-being, but a little bit more than that in its totality. Not merely the absence of disease, but obviously a lot of people live with conditions and one still has the capability to attain a good quality of life. So with prefixing it with health, we're really focused on how living with an illness or a condition or taking medication might impact your quality of life. And it does mean different things to different people. It incorporates elements of health status and physical functioning, but it is a complex concept. And in our paper, there's a lovely diagram that you may want to have a look at, which sort of demonstrates the core components of health-related quality of life, which include your right to family life, and that is the family of the individual. Family is defined in different ways in the society that we live in, and that might be more about friendships. Being able to have a working life, and if that's not a paid working life, volunteer activities, and if neither are appropriate, to feel productive as a member of society, to have energy and vitality in which to do that. And then to be able to have a social network and participate in your interests or your hobbies, whatever they may be. It also includes emotional and psychological well-being and an ability to care for yourself or to care for others at home, particularly people who may be dependent. So all those factors make up health-related quality of life, and living with sarcoidosis will impact on different aspects of that at different times, and the extent to which that impacts on whichever of those areas will in turn possibly diminish or enhance, if it's a positive thing, your health-related quality of life. And because particularly for sarcoidosis as a multi-system disorder, it is likely that one of those aspects of your quality of life is impacted at any given time. So I hope that answers the question, Leo.
Absolutely answered it perfectly, and I think it's very important that we think about all these different aspects because, like you said, sarcoidosis is a multi-system disorder that can affect people in so many different ways. So we do have to consider all of these different things that can affect it. I'd be interested to know, as I'm sure a lot of people who are watching today would like to know, how did this work come about?
Yes. So first of all, I have to say some of the people who are listening to this will have had the opportunity to read the paper. Others will not. It is published open access, which means that you will be able to access and read it, and that's something that is very important to me and to my colleagues who I write with, because publishing open access means that patients can read our work, and for us there is no point in writing if we can't share it with our patient population. And so first and foremost, we're interested in health-related quality of life in interstitial lung disease. Most of my work in the past has been around pulmonary fibrosis, but I do have a background with a generic skill set working in general practice. I'm very interested in multi-system disorders as well. And in 2019, sarcoidosis and quality of life was very much at the forefront of our minds, because we were working with our patient partners, running a series of focus groups in the US and the UK to explore the impact of sarcoidosis through living with COVID and the restrictions that brought with it, and how that impacted health-related quality of life. And so around that time, we'd been invited to contribute a book chapter on health-related quality of life in sarcoidosis. But as often happens, projects can start, particularly during the pandemic time. Sorry, I'll get my words out eventually. It has been challenging to publish in various guises, but we'd started some work on outlining this chapter and then put it to one side. And then an opportunity came up. There was a special issue called Diagnosis and Management of Sarcoidosis in the Journal of Diagnostics. And so we were invited to submit a review paper by Dr. Claudia Tanner, who was the guest editor for this special edition. And she's a clinician based in Parma and Italy. And so we wanted to seize this opportunity, and we reached out to more colleagues to contribute so that we could produce a very comprehensive review paper. Thank you, Leo.
Fantastic, thank you. And it's absolutely fantastic that it's open access. Any patient can read it, so I absolutely do recommend it. If you haven't read it already, you do read that paper. Kind of building on from that, making it open access, does that mean that the target audience, from your point of view, is patients or clinicians or family, friends, carers, or all of the above?
Yes, yeah, I would say all of the above. I think health-related quality of life is important to every individual on the planet. um, and we hope that reading this paper, that clinicians will have a better appreciation of patient perspectives, and possibly patients will also have some understanding of clinician perspectives too, particularly around sort of areas of shared decision making. And shared decision making is a two-way process. So yes, absolutely. And again, one of the reasons we wanted to publish open access is so that people could read it and go to their consultations feeling perhaps a little bit more empowered to explore certain aspects of life.
Absolutely, that's fantastic. And in addition to everything that you've said, family and friends, it would be great for them to read as well. Because I think with sarcoidosis often being an invisible condition, as non-patients, they can never really understand what a patient is going through and all the different things that can be affecting them. So it's very important that the friends of patients, family members of patients do educate themselves to try and understand what is going on as well.
I agree entirely, Leo, and I'd just like to comment further. You've reminded me of a conversation
Mhm.
I had with a lovely lady whose son, who was a teenager, had never really understood her condition, and it was only through having been forced to live together during the pandemic that he really appreciated the impact of living with sarcoidosis on his mother. So yes, I agree entirely. It's very good for family to have that wider understanding.
Absolutely, absolutely. Um, so you spoke a bit about some of the different people who were involved in putting this work together. If you read the paper, you will have seen on the first page there is a long list of names of people who were involved and who co-authored this paper. I want to give a quick shout out to two people who were involved, and that's Mike Howie, who has done some brilliant work with the London Support Group over the years and really supported a lot of sarcoidosis patients, and also to our fantastic patient ambassador, Jackie Newton, who is so selfless with her time in providing information to patients, providing support to patients. So a really huge heartfelt thank you to both of those two people for all they do for the charity. Um, could you tell us a bit about why it was important to have so many people working on this, and people from different locations as well?
Yeah, absolutely. And I echo thanks to Jackie and Mike. They're an absolute delight to work with and made significant contributions to this work and the other work that we've been doing as well during the pandemic. And in addition to Jackie and Mike, we had four patient partners, patient experts from the US as well, representing Louisiana and New York as individuals, but also on behalf of other advocacy groups. And it's essential to capture the patient perspective because that brings an authenticity and a genuine understanding. And so in addition to our patient experts and contributors, I work very closely with Leslie Ann Sackett-Koo. She is a rheumatologist by background, so very much interested in multi-system disorders, and we share interests in health-related quality of life and holistic patient care. And bringing in lots of different specialities, and as we all know, sarcoidosis is a multi-system disorder. It's a condition that we want people to learn about. So a couple of contributors to the paper are junior in their research career, and perhaps junior in interstitial lung disease as well, but learning. And so co-authorship and it giving people the opportunity to contribute develops the next generation of researchers and ensures that interest is maintained, and they will go on to make a big difference in the future. We had a colleague who's a specialist in neurosarcoidosis. We have another colleague who's a physical therapist in Holland and particularly interested in fatigue. A colleague who's a health psychologist, very interested again in fatigue and quality of life, but brings that psychological perspective. Misha Rosenbach is a professor of dermatology. Mary Beth Sholand and Matthew Lamy are pulmonologists. Mary Beth is an associate professor in Newtown, has done a lot of work in sarcoidosis, particularly in the American Thoracic Society. Colleague as well, the sort of lead experts such as Bob Boffman, Mark Judson, Marjolaine Drent, who all have a solid experience of patient-centered work in sarcoidosis. And another colleague as well who has a background in oncology and again some understanding of the journey that patients are on with a condition such as sarcoidosis that is a multi-system disorder and can have some of the same symptoms, particularly in relation to fatigue, that you might find in cancer sufferers. So everyone brings a slightly different perspective and expertise, and they ask questions, sometimes difficult questions that one might not think about when you're spending an awful lot of time in your own head. And so sharing international perspectives as well from Holland, the US and the UK really helps to ensure that the paper is internationally relevant. And again, sarcoidosis is worldwide, so we wanted this paper to be relevant to sarcoid populations across the globe.
That's great. It's really great to hear about the sort of multidisciplinary approach because, as we've said, it's a multi-system disorder where we do need to kind of have that multidisciplinary approach. A lot of the times, I know a lot of patients who aren't just pulmonary patients feel like their other manifestations do get forgotten about. So it's great to have all these different minds working together on this. It's really fantastic.
Yeah, and I think particularly having the patient contribution, it's so wonderful working with patients as contributors. It makes a huge difference to the paper.
completely agree. Yeah, absolutely. Let's talk a little bit about the content of the paper. One thing I wanted to talk to you about is in the paper, it describes how health related quality of life can be favourably or negatively influenced by a couple of things, including personal factors, environmental factors, and symptom burden. Um, if you don't mind, could we go through each of those terms and talk a bit about what they mean and how they can affect health related quality of life? So let's start off with personal factors.
Sure, yes. So I think it's really important that we continue to live life as an individual. And just because you have a diagnosis of sarcoidosis doesn't mean you become a different person. And you are an individual first with a health condition. It shouldn't be the health condition that defines you. And so I'm always really keen to look at language that we speak about patients with sarcoidosis, not sarcoidosis patients, because it should be person first, disease second. And so as individuals, we all have different ways of coping. We also experience different chapters in life, depending on what's going on at home with children or with elderly parents. With loss of loved ones, life goes on, and that impacts over time our ability to cope and adapt to change. And so you will all be at different stages of life, and again, your health condition, the sarcoidosis, has to run alongside that and has to be accommodated. I think it also relates to how long you've been living with sarcoidosis. You may be newly diagnosed, or you may have had sarcoidosis. It may have burnt out. You may have got through the other side. And that experience of living with a condition, or possibly having a comorbidity, say concomitant diabetes or arthritis, may also have impacted your ability to cope. Some patients I know attend patient expert programs, and that will help inevitably with how you manage your condition. And also thinking about your approach to symptom management and the fluctuation of symptoms and the good days and the bad days, and how reliable and successful your self-management strategies are. So all these personal factors will impact on your health-related quality of life, and that will be individual to your specific context.
Okay. And how about environmental factors?
Yeah, sure. I mean, you raised, Leo, the importance of family, and family are incredibly important, and it's part of the environment that you live in. But so often people live alone, and so thinking about other support as well, and friends that you can rely on, or advocacy agencies. Environmental factors would also include your financial resources. It may be that you need some assistance with living, access to buildings, and environmental factors we'd also think would probably include techniques and training that help you to manage your not only your physical but also your emotional and mental well-being as well. Particularly, I guess, during the pandemic time, it might have been about having access to a computer and having access to Wi-Fi so that you could remain connected and be part of the patient support groups that I'm sure all of you find very beneficial.
Thank you very much. And the next one I think is a bit more self-explanatory, but if we could cover symptom burden as well.
Yes, for sure. I guess that sadly, people who are listening to this talk are all too well of the symptom burden associated with sarcoidosis, which can fluctuate and can be quite debilitating at times. And I guess alongside that, there's also medication side effects as well that some of you may experience, and not only the physical but the psychological impact of living with a health condition. And so many of you will perhaps have experienced weight loss and fatigue and insomnia, those sort of constitutional factors. For many of you, you may struggle with anxiety or depression or psychological distress, which I would often say is a normal response to adapting to living with a condition. So if you're in a newly diagnosed status, that might be something that you're experiencing at the moment. There's the neurological symptom burden, so often headaches. Some people may experience falls. They might experience numbness or tingling and have headaches. Some people will experience acuity impairment from the sort of ocular burden or dryness around the eyes, or possibly also increased pressure or glaucoma. And of course there's pulmonary sarcoidosis as well, and so for people in that category, breathlessness and cough, the exercise intolerance, and possibly other associated conditions such as pulmonary hypertension will impact how you're able to live your life. And alongside the gastrointestinal symptoms as well of indigestion, possibly nausea or vomiting, and then the overwhelming fatigue, and possibly for some people dermatological problems with lesions and itching, especially the redness, the erythema nodosum, and some people experience ulceration. And the musculoskeletal side as well, which can make you feel lethargic, and also perhaps a little bit weaker with sort of myalgia, aching muscles. And so not everybody has all these symptom experiences, but depending on how your sarcoidosis is affecting you, there will be a group of symptoms that you're living with day to day. Some days you probably approach it more positively than others. As I say, it fluctuates, and depending on what those symptoms are, they will impact to greater or lesser degrees onto those elements of health-related quality of life we looked at earlier.
Absolutely, yeah. There really is a lot to consider when it comes to health-related quality of life in sarcoidosis. And I suppose one thing, relatively new thing from the last sort of year and a half that I suppose comes into it now as well is the COVID-19 pandemic, which will have, for a lot of people, had a negative impact on their health-related quality of life. And now I know you said you did a survey as part of this work to do with COVID, and I'm sure you have done some work in other places as well. How do you think the COVID-19 pandemic will have affected patients' health-related quality of life?
I think that the work that we did, there were a lot of sort of similar experiences between the populations we spoke with in both the US and the UK. It was very different depending on which stages people were at. So I guess for some people with severe symptoms, in some ways, COVID didn't feel too different because that individual was used to living a life that was fairly much in keeping with the principles of cocooning, is the Irish expression, but sort of self-isolating. In terms of practical factors, there were a lot of difficulties with people living in the US around access to medications. I think that was possibly the same in the UK as well. Not only getting the medication because there were short supplies, but actually getting to the pharmacy or having them delivered, and feeling safe if you had to go and pick up medication from the pharmacy. I think that for some families, as I mentioned earlier, just having to manage life of reducing risk of exposure to COVID in a mixed family where people were going out to work raised a lot of challenges, and possibly increased strain on relationships at times as well. In terms of managing perhaps symptoms like fatigue, it may have been better for some in view of the fact that there was a greater flexibility for working, and a lot of people could work from home. And so we hope that sort of continues in the longer term, really, that now there has been a change in culture, that people who are more productive and can work from home should be supported in doing so. So yes, I think, Leo, probably a lot of those things were experienced by other people with chronic conditions as well.
Yes, and just a little side note to anyone watching today: if you are struggling with any of the things we've talked about so far in this video, please do get in touch. We are always here to support you in any way that we can. We have a fantastic nurse helpline that has 3 very dedicated and very experienced nurses who make calls to sarcoidosis patients. So whether you're struggling with personal factors or symptom burden, or struggling because of COVID-19, any of these things, it's our job to help you. So please do get in touch with me in the office, and I'll schedule a call for you to get a call from one of our nurses. We kind of touched on fatigue there, which is a very common cause of symptom burden in sarcoidosis, and I think it's often a symptom that gets minimised by people who don't understand it as well. Could you tell us a bit more about how fatigue affects health-related quality of life, and any ideas on how it can be managed?
Yes, I mean, I think fatigue is a big problem for people who have sarcoidosis, and I know a lot of the studies sort of report on prevalence of between 50 to 80% of patients would experience a sort of significant adverse impact on their health-related quality of life solely because of the fatigue, which I think we still don't yet fully understand. And again, fatigue is multifactorial, so it makes it a little bit more challenging to manage. We think there's sort of associations with inflammation, and also associated with the cytokine release as well. And then, of course, if one is struggling with mood and feeling a little bit depressed, fatigue and depression can often go hand in hand, and exacerbate one another. And if your sleep is disturbed, or you have symptoms of neuropathy, that, of course, as well can impact on that feeling of fatigue. So I was talking to Marjolaine Drent at the European Respiratory Society Congress, which has recently happened, and she did a very nice presentation for the Russian group around fatigue and how people living with sarcoidosis manage fatigue. And we were thinking that one of the positive spin-offs of COVID-19 was that people are talking about fatigue now, because it's affecting younger people, and it's acknowledged as a major problem across the population. It is attracting a lot more attention. And so now there are the long COVID clinics that are looking at ways to support people with fatigue. We hope that there can be perhaps a little bit of joint learning between the long COVID communities and the sarcoidosis communities. I mean, people who have experienced fatigue will know better than me what that is like, and that sometimes it is really about setting realistic goals so that you're not setting yourself up to fail, and getting through your day through pacing, accepting that some days are just difficult, and then doing what you can within your limitations on a good day. Approaches to physical therapies as well. I think perhaps that's the negative aspect of living with COVID-19 is that people who had access to a physical therapist or a physiotherapist may be few and far between, and that's possibly dwindled as a result of the pandemic. I guess other things have popped up to replace that, such as singing groups and some digital forums that it's possible to join in to do exercises such as Tai Chi or yoga, with the option of doing seated yoga and adapted yoga for people who understand interstitial lung diseases and sarcoidosis, and mindfulness practice as well. And I think that knowing your own core physical capacity, and then choosing an exercise regime that fits within those parameters, but modifying it is a good way to keep your mind and body active and supple and stretching. But these things should be enjoyable as well, so that you're feeling good. And also, if you start your yoga program and you can't complete it, it doesn't matter. You can finish it the next day. But just attempting to do something that enables the body to feel challenged, and also to challenge your mind, is very important.
Absolutely, I think that's some absolutely fantastic advice. And I think it must be hard to kind of get that balance right, isn't it, between doing the exercise and also listening to your body and make sure you are doing what your body allows. We've had somebody write a comment saying, I started the Couch to 5K program last year, but wasn't able to complete it. Had to keep stopping and starting, but was pleased that I still did some running. So I suppose
Yeah,
that is a good thing that this person was out running. And I think another great thing that you said, a lot of us think, those of us aren't natural exercisers, a lot of us think, oh, exercise has got to be running and all these very difficult things. But I'm glad you gave the examples of sort of yoga and Tai Chi, and these are all types of exercise that might be more suitable to somebody who is living with chronic pain. Um,
yeah.
Let me just find where I was on my list for my next question. Yeah, so we've spoken a little bit about how sarcoidosis can affect different areas of a patient's life. I'd like to talk about three areas that are discussed in the paper, and those are work, family, and social life. What advice? Well, first of all, let's go through each one. How are these how are these areas affected? And if possible, what advice would you give to a patient who is struggling with those areas? So if we start off with work.
Yeah, I mean, work is such a big part of life, isn't it? And I think for a lot of people, we can be defined maybe sometimes too much by our work, and then you get a diagnosis of a condition like sarcoidosis, and it takes you off in a completely other direction, and thinking about how you manage and integrate life with the symptoms that you experience with the type of work that you do. And I think for most of us, knowing that we're doing something worthwhile gives a feeling of self-worth. But most of us also don't work from a place of altruism, but we also work for financial necessity. So I guess there are worries that if work productivity is impacted, then that's going to in turn impact financial stability. That might result in family hardship. And then it will have a very sort of marked impact on health-related quality of life. For some people, depending on their baseline economic status, some people will have disposable income and savings and might be able to modify the work pattern to go part-time. I think in the UK, we might, in some regards, be better off than the US in terms of workplace policies. I think there's probably quite a lot to do in terms of managing co-worker attitudes, particularly in relation to fatigue. As I say, I'm hoping that recent discussions of fatigue in relation to COVID-19 are impacting perhaps some poorer perceptions that fatigue is psychological and not physical, and therefore makes the work environment much better. It will depend on where your position is in the workplace in terms of the hierarchy, and also on the nature of the work and how supportive your work environment is, to whether you can have time to work at home instead of going into the office or place of work. But again, I think we have a lot to do in terms of ensuring not only individuals as patients are realistic of their expectations of self, but also working with families and employers so that we can sort of anticipate putting in some preventative measures that enable people to function as well as possible for as long as possible. And in the US, they have a 6-day donation program, and probably a bit more flexible work, although I think that's changing here now. So what I would say is if you're struggling in this area, I would involve your human resources department early on. If you have an occupational health department, involve them early on as well. If you're really struggling and work is feeling a little bit hostile, then I would get some advice from Sarcoidosis UK and through the patient support group. And it may be that you need some independent advice from an employment union, or from Citizens Advice. And if you sort of needing something more, I know that there are some universities offer free legal advice as well for their students who are studying law. So if you think you need something specific around employment, you could Google what's available in your area, and that may help as well.
Thank you very much, Dr. Russell. Once again, fantastic advice for sarcoidosis patients. And just one more thing I wanted to bring up. We do have, for anyone watching today who isn't aware, we have a sarcoidosis information for employers leaflet, which patients can share with their leaflet, with their employers, and it just explains what sarcoidosis is in sort of layperson terms, and what the impact of it is, and what that might mean for their employee who has sarcoidosis. And then the last page of the leaflet is practical advice for employers who have an employee with sarcoidosis. Completely free to download from our website. So if you think you need some help explaining to your employer a little bit about your condition, please do download a copy of that leaflet to share with your employer. Otherwise, you can also request physical copies to be sent to you in the post as well, which we'll send for absolutely free. So please do get in touch if you would like us to send you some of those. We spoke about work. What about family?
Yes, family are very important in terms of supporting the person with a diagnosis, but I think it's also thinking about who those individuals are within the family, and may be transitioning to take on a caregiver role. That's not always an easy transition to make, and can impact the caregiver as well, who may have their own health issues. And may also need support. I think that in some areas it's a little bit patchy. There is a lot of support for caregivers. I know that Sarcoidosis UK as well would offer caregiver support if you're struggling. We know from studies that have been done that about 50% of caregivers report that transitioning to that role has negatively impacted family relationships and finances. And so having space to talk about how everyone is coping with the condition, and sometimes that may involve formal counselling as well, but so that the individual has an opportunity to talk about themselves and their own journey. But also that the caregiver, and it may be that there are joint conversations, but it may be also that caregiver or family member needs their own space and their own counselling to work out how to cope with perhaps what feels like a stress or strain, so that some stress reduction strategies can be developed. And again, this is where advocacy organisations are really, really important. And so I guess it's the old BT advert, isn't it? It's good to talk. But I think it is, and I think that if you can't talk within the family for a variety of reasons, families are complex, then making sure that you're talking to someone outside the family, so that you can be the best that you can be within the family unit is probably the best advice I would give.
I agree, which kind of leads us on nicely to social life. And I mean, I regularly see people posting on our Facebook group, or people calling in who have some problems with their social life, and friends not quite understanding when they have to cancel plans last minute, or if they have to maybe not see their friends for a little while because they're flaring up or something like that. Could you tell us a bit about how sarcoidosis can affect social life?
Um, that's a really interesting question at this
Mm,
juncture in life.
yeah.
Um, I think that possibly again there's a positive spin-off from living in a pandemic, that in that no one has had an external social life, and that we've all found different ways to connect and communicate, which I think has been very good for those who are digitally literate and have a good Wi-Fi connection and have access to a computer or a tablet. And I think it's set a new trend now that people are much more open to meeting digitally, and to perhaps sharing a glass of wine if one drinks alcohol, or just having a chat, or having party nights. Um, but of course, we are, as humans, often tactile, and like to be with other people. Um, I think now, because of the change in the digital culture, it's probably less frowned upon, and it may make it easier to withdraw from a social event if you're feeling that you can't actively participate. And it might be that now people are more open to you joining digitally instead of physically, which is not a bad thing. But again, I think it's that key thing about pacing, and knowing which events are really important, and how you're going to keep your social connection in a way that works well for you. If you're in a bad phase of maybe struggling with depression, or really going through a bad phase of struggling with fatigue, then you just have to be open and honest, and people who are good friends understand. And as I say, make the most of that digital connection whilst it's socially acceptable to do so.
Absolutely. Um, I wanted to talk about two terms that are used in the paper, and those are patient-centered care and shared decision making. What is meant by these two terms, Dr. Russell?
Yes. So patient-centeredness is a very important concept, although it's increasingly referred to as person-centeredness. And I guess that this is something that was discussed a lot in the 1960s. And a lot of the early work came from family-centered care models, so really general practice. And there was a few psychologists, such as Bailey, working in this area, who said that patients must be more included in the consultation. That consultation shouldn't just be about the doctor talk, and about the doctor dominating the consultation. And so increasingly we've become open to the fact that we can ask patients for their own hypothesis about what is wrong with them. And after all, you're living with a condition, you're the expert in the symptom burden, and you know how it impacts you more than anyone else possibly could. Um, and also, I think, open to criticism as well. I know occasionally I've had a tricky consultation, and at the end I might say that wasn't quite how I was expecting this conversation to go, and I'm not sure that it worked well. What can we do about that? So we don't always get it right all of the time, and so working together to understand what a patient needs and what the patient agenda is in that consultation, and doing as much as we can to meet those needs. And I guess that fits very nicely with the sort of health-related quality of life conceptual framework. So it's moving away from the sort of biomedical model, and thinking more of the biopsychosocial model of illness or disease. So understanding, the kind of pathology, the science behind a particular disease, in this case sarcoidosis, but also thinking about emotional well-being, and also thinking about that wider network of family and friends, and environment, and considering things such as health promotion as well. And so patient-centred care is a strong theme for the PICA Institute, who are based in Europe. And they identified sort of 8 concepts of patient-centred care, which again interrelate nicely with the health-related quality of life measure around involving family, around having access to health services and information, a feeling that you're getting the best possible effective treatment and some continuity of care that's perhaps more challenging in current times. And so what I would hope is increasingly when you're seeing your clinician, and I'm aware that a lot of people still be having telephone consultations or video consultations, but that you will be asked to report your experience of the service that you're receiving. And so this would be completing something called a patient-reported experience measure. And these are increasingly being used so that clinicians and health service providers can really understand how the service that we deliver is received, how it's impacting on you, and the areas that we need to improve upon to make healthcare better. Did you ask me about shared decision making as well, Leo?
I did, yeah, and
Yeah.
I think the points you made about the person-centered, the patient-centered approach were fantastic because, as we know, with sarcoidosis affecting people in so many different ways, a one-size-fits-all approach just does not work. So we are very supportive of a patient-centered approach. But yes, shared decision making. Why is that so important?
Again, it's interesting, isn't it, that I think often in this day and age we're very critical of general practice, but and I think general practice is particularly struggling at the minute because there's a shortage of personnel. But a lot of great work did come out of general practice, certainly through the sort of 1980s, 1990s, through to the early noughties. And so as well as the sort of concepts around patient-centeredness and family healthcare, shared decision making, a lot of the early work was done by a GP, former GP Adrian Edwards, based at the primary care unit in Cardiff, and his colleague Glyn Elwyn, and sort of shared decision making as it has evolved really as a science in its own right. And the National Institute for Health and Care Excellence has now published a guideline on shared decision making just in June this year, so that's freely available, and I can send the link to Leo actually. Some people might be interested to follow up and look at that if you haven't seen it already. And so I guess that shared decision making would be defined as a collaborative process that involves the person or the patient and the healthcare professional working together to reach a joint decision about care. So it is not about a healthcare professional telling you what you should be doing. It might be that a healthcare professional needs to share some detailed information about recent research, some thoughts on treatment options, whether they're pharmacological or non-pharmacological. But it really should be an honest discussion about what is right for you in the context of your life in terms of managing where you're at in this juncture. And that you as a patient feel empowered to disagree or to ask why. And so that you come out of the consultation really feeling that you've got a good handle on your management plan, that you know what that management plan is, that you've got some clear parameters, that if you fall outside those, there's a plan of action and you know who to contact. And that there's a contingency plan in place. So, it's been decided if the unexpected happens, what do you do, who do you contact, where do you go? And that to my mind is a good consultation. So patient-centeredness and shared decision-making go very much hand in hand.
Definitely, yes. Thank you very much, Dr. Russell. Now, I know we've kept you for quite a long time. Are you okay for a handful more questions?
Yeah, sorry, I talk a lot.
No,
So
it's been great.
completely lost track of time. So
No, it's
sorry.
absolutely great, as long as you're okay for a couple more.
Yes, of course.
Thank you
Yes.
very much. So one part of the paper I found particularly interesting is where it's written a clinical environment can either perpetuate stress or be a source of reassurance and stress reduction for the patient or family. Could you elaborate a bit on that for us, please?
Uh, I think this is something that I've become to appreciate a lot more, having worked a little bit in the US and in different areas of the UK. And a lot of this is around feeling valued, and some of that is around the physical environment. So I think if we're all aware that the NHS is struggling with its infrastructure in many regards. There are some fantastic centres built, such as Southmead Hospital in Bristol, which was built a few years ago under shared private and NHS monies. But a lot of buildings are kind of really struggling to keep pace with modern life. But they can be adapted. So just walking into an environment that has been freshly painted, that isn't cluttered, that feels welcoming. We all have homes, and a sort of sensitivity to decor. I think it makes a big difference, and it's the people in the place that you might be met by a volunteer who is smiling, who is helpful, who can signpost you where you need to go. If you need a wheelchair, that's made easy for you, that you're met by a porter, that there is a ramp that you can go up. If you need hospital transport, that a loved one can travel with you, ideally, so that you feel supported. That you have privacy within the consultation room, that the walls are solid enough that you're not hearing conversations, and all these things, if they're not in place, can make you feel quite stressed. And really, just going into the right environment enables you to focus on your condition, and what you need out of that consultation, without having to worry about safety factors, about infection risk within the waiting room, and particularly about privacy as well. And then if you have to be in hospital for any length of time, and environment also would also stretch to families. If a caregiver needs to stay with you, where is the accommodation block? And is that accommodation provided of what you would expect, at least a reasonable standard, and it's clean, and that your caregiver feels safe staying there. And I guess also having access to good food. I know I've often worked late, and I wanted to go and get a hot drink or a cold drink, and you find drinks machines full of fizzy drinks, or the coffee machine is coffee that is water and milk and nothing much more. So, how do we look after people? How do we ensure that you're appropriately refreshed, that you can at least get some clean iced water, that there's an array of meal options available, and that your food will be served nicely and look appetizing. Simple things. And it is these simple things that can make a huge difference and cause a huge stress, particularly if you are an inpatient for a period of time. And I guess the part of that within COVID times is just ensuring that you've got a good digital connection if you're having a video or an audio consultation now, and that you can see that the environment you're speaking to your clinician, so the clinicians have some responsibility here to blur their background if they're in a messy room, but they're not calling you from a busy office where you can see a lot of activity that's distracting, but you feel that you've got their full attention. And I think if you don't feel that, then you have got a right to ask if you can maybe reschedule that call at a time when you know you're going to have your clinicians' undivided attention, and you can optimise what you get out of it.
Thank you very much. Yeah, very, very useful to know. Something I was really happy about is the paper talks about the important role that patient organisations play. Why do you think they play an important role, Dr. Russell?
To a great extent, it speaks for itself. I think Sarcoidosis UK do a fantastic job on a very small budget and a small sort of staff supporting activity, but advocacy organisations are invaluable. I think particularly more so during these times where the NHS is perhaps struggling and has long waiting lists, and it can be very frustrating when you're waiting to get through to speak to a clinician. So I guess in that regard, the nurses who provide the helpline support through Sarcoidosis UK do a fantastic job. Just knowing that you can call up and talk to someone who will either help or signpost you to someone who can, and may help you in terms of formulating some questions to ask your clinician, particularly if you're newly diagnosed with sarcoidosis or you've gone through a major transition and you're really trying to understand what's going on. But I think also the other thing are patient support groups, is that shared experience. And I do know that patient support groups are not for everybody, but I think for a lot of people it provides a forum that is safe. There is a wealth of knowledge in patient support groups because people have had their own journey, that you're likely going to meet someone who's been there before, and they will be able to give you lots of advice. Of course, you can select the advice you want to take and leave behind that you don't. And the patient support groups also may have a caregiver support group as well, which supports family and friends who may be involved with your care. And furthermore, in terms of lobbying activities, clinicians are increasingly busy with clinical workload and research activities on top, and perhaps have less capacity to lobby for change. And so being able to work with patient support groups is fantastic in terms of negotiating patient charters for what good care should look like, and influencing policy at national level so that we ensure that you get the care that you need and deserve. Thank you.
Thank you for your very kind words as well. So we get questions quite often about sort of managing, how can patients manage their sarcoidosis on a day-to-day basis. And the paper does include a section about self-management strategies for patients. Could you tell us a little bit more about that?
Yes, indeed. I mean, I think that self-management will vary according to your individual context. And I think self-management is not about feeling on your own. Any sort of self-management program with a chronic condition should be about supported self-management. And again, it taps into some of those things that we already mentioned. So you really understand what your plan of care is. You've got a clear vision of what you can safely do in view of the sarcoidosis, but also perhaps taking into account other health conditions that you might have. So what is safe activity? What are the parameters for change if you're doing any self-monitoring at home? So for example, you may have some fluctuating lung function if you've got some pulmonary involvement. How can you measure and monitor that at home? Can your clinician offer you any devices or recommend any devices that might be helpful for you to use? If you're really struggling with fatigue and you maybe want to do step counts, for example, what device, which app should you be using for step counts? What is safe to do? When should you stop? Who do you contact if you're worried about any changes in those parameters? And again, I think it, to a certain extent, a diagnosis of a long-term or chronic illness leads to a need for some self-discipline as well. So feeling that you are supported will help you to hopefully feel more confident and able and committed to taking on some elements of self-management as well, knowing that there is a support network there to feed back into.
Thank you very much. Some really, really practical and useful information there. So moving to our last few questions, what was the overall conclusion for this piece of work?
So we're very keen that our fellow clinicians have an appreciation of what health-related quality of life is and what can influence this. And we, from this work and other work with patient partners as well, has led to us thinking about what future research should look like as well. So we did include some recommendations for further research and areas of exploration. So we do feel that we need to know and understand a lot more about patient perspectives, and also ensure that patients are very much integral to future research designs, so that we have patients involved in research projects from the outset. And again, that doesn't suit everybody, but there are probably different aspects of research that people can be involved in, both as an investigator as well as a participant. We also aware that there can be racial disparities in sarcoidosis, and so again thinking about inclusivity and thinking about national policies and how we can influence care to ensure that that everyone has equal access, and we're avoiding that. We think there's a lot more work that needs doing around fatigue in sarcoidosis. I'm sure everybody would agree with that. I think that we need to understand it a lot better and think about how we can develop protocols for managing fatigue. And think about how we support people who may experience these sort of flares or exacerbations as well, and how fatigue impacts on that. So I think probably just in the interest of time, I won't talk about all these areas, but I would encourage you to have a look at the end of the paper, at the list that we include. And I think we would sort of say there needs to be much more discussion about how we measure health-related quality of life as well. What measures, what questionnaires we would choose to include, and particularly how we capture patient-reported experience. So how we can only improve services if we know what we're doing well and know the areas of deficit, and also think about how we're engaging well with patients and areas that we need to work on. So again, collecting patient engagement measures will help nationally as well.
Thank you very much. I just wanted to read you a lovely comment that someone's just written on Facebook. Fantastic talk. Thank you so much for doing this, and an excellent paper. Really so helpful in an area that doesn't have enough written about it. Great to see psychological distress and pain, two areas which are too often not focused on. Very thorough and inspirational. Thank you. So just a lovely comment from a patient there.
Yes, thank you.
We've had somebody submit a question live. If we could do that one as our last question. It's from Dana, who asks, what do you think can be done to help ensure that patients don't take on guilt and blame for not self-managing perfectly? Is it something to address with patients or healthcare providers?
I would say thank you for that question. I hope that's not how you're feeling. And I think what I would say is that, to be human is to err, whether we have a health condition or not. So none of us are perfect. And we have good days and bad days. I think that guilt is a feeling or an emotion or an experience that if you're having, I want you to put it into a Chinese lantern, maybe just visually, and just let it go, because it's not going to do you any good, and it's not going to move you further on. And so there will be days that are a struggle, and you don't achieve what you set out to achieve, but there will be other days that you do, and there will probably be more days that are positive than the days that are negative. I think that clinicians have a duty to support self-management. So self-management is not about feeling that you're on your own. Self-management is about doing what you can, what you're able to do, recognizing that that fluctuates and celebrating your successes and thinking, well, I would really have liked to have done that today, but I didn't quite make it, but that's okay. I'll have a go tomorrow. And if I don't achieve it tomorrow, then I'll have a go the next day. Or if I'm just not achieving this, maybe I have to accept that it's unrealistic to expect that I can, and that this goal needs some modification. And I would maybe also say that if you're sort of struggling and you're the type of person who has a tendency to beat yourself up, is to maybe see if you could have some counselling and support to work around those areas, so that you learn new ways of being that enable you to be more positive and the best that you can be. Thank you.
Thank you, Dr. Russell. Some really, really, really useful advice there. I will draw this to a close now, but I wanted to say a big, huge thank you to Dr. Russell, who's been so generous with their time today. And I know that a lot of sarcoidosis patients will be really grateful for this, as well as for the paper as well. So thank you so much. I hope that one day we'll be able to do another Q&A session together. Dr. Russell has very kindly said that if there are any follow-up questions or comments, she'll happily answer them. So get in touch with me on leo@sarcoidosisuk.org if you have any comments or questions, and I will check in with Dr. Russell, who has kindly said she will help out with that. Dr. Russell, thank you so much.
Lovely. Leo, may I just say thank you to all your patients at Sarcoidosis UK for all the help that they have given me over time as well, with research endeavours and completing surveys. It really is very much appreciated. Thank you.
Thank you very much, and yes, thank you to everyone who's watching today as well. I hope that you enjoyed this Q&A, and we hope to see you again for the next one. Just before I go, I am going to ask if you are able to anyone watching, if you're able to make a donation to Sarcoidosis UK, please head to sarcoidosisuk.org/donate. We are a very small charity. We don't have a huge budget, and we don't receive government funding, so we are funded almost entirely through personal donations. So if you are able to make a donation, no matter how big or small, it will be extremely appreciated, so that we can continue sharing information, spreading awareness, funding research into a cure, and supporting sarcoidosis patients. Thank you so much for your time today. If you ever need any support, please do get in touch with us, and we will be happy to help. Thank you very much.
Lovely. Thank you.